Hey everybody, welcome back. Let's talk about premature ventricular complexes. I received an email from somebody asking if I could take a look at what the literature says about using vagus nerve stimulation to address premature ventricular complexes. These are irregular heartbeats that can feel like a flutter or like a skipped beat. And I found a couple of interesting articles on this subject. This is another area where they are actively doing research right now. They are recruiting for participants in research studies so that they can expand their knowledge on this topic. And I did find some preliminary studies. This was an interesting one. They had 35 participants, and what they did is they randomized them into two groups, and one of the groups got true vagus nerve stimulation for 1 hour per day for 10 days straight. The other group got sham vagus nerve stimulation for 1 hour per day for 10 days straight. Then they had an 8-day washout period, which means they didn't get any treatment during those 8 days. And then they swapped the groups and had the group that had the sham stimulation first have the true stimulation and vice versa. And what they found was that when the individuals had the true vagus nerve stimulation, regardless of which group they were in, regardless of who had it first, that they did see a significant improvement, what they call a decrease in the PVC burden. So a decrease in the premature ventricular complexes. So improvement in that extra heartbeat experience. And these are people that were resistant to medical treatment. So they had tried giving them medications to address this issue, and they did not have success with that. So those authors concluded that vagus nerve stimulation was a wonderful adjunct treatment for this condition, and can be particularly beneficial for those who may not respond well to medication treatment. The other study that I saw was really interesting because it actually looked at medications. So it used medications that have a secondary effect of activating the vagus nerve by activating the parasympathetic nervous system. So they wanted to see if we indirectly activate the vagus nerve using medications, what will happen to the premature ventricular complexes. And they found the same result. So using medications also to activate the parasympathetic nervous system, activate the vagus nerve, improves reduces the number of premature ventricular complexes. So interesting research as always. I love when you guys give me these topics to look up because it's always fascinating to me. So thank you for being here. If you haven't been here before, my name is Carissa Conrad, and I'm a doctor of physical therapy and therapeutic pain specialist, and I am the vagus nerve PT, and we'll see you on the next one.